Hey there, welcome back to How to Medicate and welcome to this new video on how to use escitalopram, also known as Lexapro. This video is part on a video series on mental health problems, and for those of you who want to keep on learning, check out the playlist in the description after watching this video, of course. For those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get started. Now the generic name of this medication is escitalopram, but it's sold under the brand name Lexapro and is available as a tablet or as drops. Which brings us to how to use this medication. If you want to use it as a tablet, make sure to swallow it whole with half a glass of water. And if you want to use it as drops, then add some drops in half a glass of water and drink it. You could also mix these drops with a sweet and sour drink, such as orange juice or apple juice. Then it is advised to take escitalopram in the evening if you are experiencing its dazing effects. However, if you are experiencing its agitational effects, then please take it in the morning. Regarding the duration of use, it's usually advised to try escitalopram for 6 to 16 weeks. If you do not experience an improvement of your symptoms, escitalopram might not work for you. However, if you do experience benefits of its usage, then you should usually continue it for 6 months up to several years, depending on your doctor's advice. Now, escitalopram is part of a group of drugs called selective serotonin reuptake inhibitors, SSRIs. This group of drugs selectively inhibits the uptake of the neurotransmitter serotonin in your brain. And this can be used to treat several mental health conditions like a depression, panic disorders, and off-label it can be used to treat anxiety disorder and bipolar disorder. Now normally I would discuss the correct dosages here, but I can't do this for escitalopram as the correct dosages differ too much depending on the indication of use, the symptoms you might experience, and the possible side effects you're experiencing. Therefore, always use the prescribed amount and frequency your doctor gave you. However, the usual dose most doctors prescribe is 5 to 10 milligrams of escitalopram, which if necessary can be increased up to 20 milligrams once a day. Escitalopram is a very effective drug, but unfortunately it can have some serious side effects. I will discussing some of the most common ones in this video, but if you're looking for a complete list, check your leaflet or ask your prescribing doctor. Very commonly it might cause headaches, nausea, and withdrawal symptoms when treatment is discontinued. Commonly it might cause anxiety, restlessness, dizziness, excessive sweating, erectile dysfunction, and weight gain. Uncommonly it might cause agitation, confusion, a nosebleed, and a rash. And rarely it might cause a severe allergic reaction, aggression, and a slow heart rate. Which brings us to safety. Please be careful when you combine escitalopram with alcohol, as this might increase its dazing effects. Also be careful when driving if you're using escitalopram, as again, it might cause dazing effects, dizziness, etc. If you're experiencing any of these symptoms, then please do not drive, as it might be dangerous. And lastly, escitalopram can have interactions with other drugs you might be taking. Always discuss this with your prescribing doctor. Now, as you might know, we end these videos off by taking a look at the safety of escitalopram when pregnant or when breastfeeding. And unfortunately, it can be dangerous in both cases. However, there are some exceptions. If you're pregnant or if you're breastfeeding, always discuss this with your prescribing doctor. Which brings us to the end of this video. I hope it was useful and I hope you now know how to use escitalopram. If you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. And for those of you that want to keep on learning, check out the playlist in the description or I will put a link to it up there. Before you go, I want to thank you all for watching this video. Please leave a like, this will help out the channel tremendously, and consider subscribing so you never miss such an awesome medical video again. All that rests me is to thank my sponsors on Patreon. Thank you Sebastian, who is an investor tier supporter, and thank all of you. And for those of you that can't get enough of this channel, I also made an Instagram account at How to Medicate. Check it out so you can see daily updates. Thank you all, and I will see you next week with a new video. Bye bye.